People use the term detox to cover that period when people have suddenly cut down their drinking or have stopped completely. Now, if you think of the brain like a spring, the nervous system, if you think of it as a spring, alcohol's been sitting on it like a heavy weight. When that weight is suddenly removed, that spring is unstable. And that shows in the nervous system as shaking, trembling, a feeling of intense anxiety, or can even show through in epileptic seizures, or could even disturb the brain so much that there are hallucinations and delusions. All that's pretty serious. And therefore we take particularly the detoxification from alcohol very seriously. We have a system at Castle Craig for closely monitoring how a patient is managing through that first 4 or 5 days. We don't want to give them so much replacement sedation that they are sleepy, because that's not pleasant, it's not necessary, but they need to have sufficient cover with a sedative type of medication so that they don't, for example, develop a seizure. So we use, the nurses regularly will use a checklist which gives us an accurate idea of what dose of medication is needed. So we don't, as sadly used to happen in some hospitals, give people so much medication that for the first week they were really half asleep. But on the other hand, we are able to safely take people through this first week or so.
In the case of alcohol detox, what we will generally do is substitute another similar acting drug, such as Librium or chlordiazepoxide, and this will stop the alcohol, substitute chlordiazepoxide, and enable a safe and gradual withdrawal of this medication for the individual. Of course, alcohol withdrawal is associated with potentially serious complications, and so the substitution of another drug and the gradual reduction of that is an attempt to ensure that the detox process is managed safely for the individual.